Hello students, welcome to the fifth session of Human Health and Diseases. In this session, we will be discussing about drugs and alcohol abuse. Surveys and statistics show that use of drugs and alcohol has been on the rise, especially among the youth. This is really a cause of concern as it could result in many harmful effects. Proper education and guidance would enable youth to safeguard themselves against these dangerous behavior patterns and follow healthy lifestyles. When drugs and alcohol are taken for purposes other than medical or taken in amount or frequencies that impairs physical, physiological or psychological functions, it is called drug abuse and alcohol abuse respectively. The drugs which are commonly abused are opioids, cannabinoids, and coca alkaloids. Majority of these are obtained from plants. Some of them are obtained from fungi. What are opioids? Opioids are the drugs which bind to specific opioid receptors present in our central nervous system and gastrointestinal tract. Heroin, commonly called smack, is chemically diacetylmorphine, which is a white, odorless, bitter crystalline compound. This is obtained by the acetylation of morphine, which is extracted from the latex of poppy plant Papaver somniferum. It is generally taken in by snorting and injection. It is a depressant and slows down body functions. What are cannabinoids? Cannabinoids are a group of chemicals which interact with cannabinoid receptors present principally in the brain. Natural cannabinoids are obtained from inflorescence of the plant Cannabis sativa. The flower tops, leaves, and resins of cannabis plant are used in various combinations to produce marijuana, hashish, charas, and ganja. It is generally taken in by inhalation and oral ingestion. These are known for their effects on cardiovascular system of the body. Cocaine or coca alkaloid is obtained from coca plant or Erythroxylum coca native to South America. It interferes the transport of neurotransmitter dopamine. Cocaine, commonly called coke or crack, is usually snorted. It has a potent stimulating action on central nervous system, producing a sense of euphoria and increased energy. Excessive dose of cocaine causes hallucinations. Other well-known plants with hallucinogenic properties are Atropa belladonna and Datura. Drugs like barbiturates, amphetamines, benzodiazepines, lysergic acid diethylamines, and other similar drugs that are normally used as medicines to help patients cope with medical illness like depression and insomnia are often abused. Morphine is a very effective sedative and painkiller and is very useful in patients who have undergone surgery. Several plants, fruits, and seeds having hallucinogenic properties have been used for hundreds of years in folk medicine, religious ceremonies, and rituals all over the globe. Tobacco has been used by human beings for more than 400 years. It is smoked, chewed, or used as a snuff. It contains a large number of chemical substances, including nicotine, which is an alkaloid. Nicotine stimulates adrenal gland to release adrenaline and noradrenaline, into blood circulation, both of which raise blood pressure and increase heart rate. Smoking is associated with increased incidence of cancers of lung, urinary bladder and throat and diseases like bronchitis, emphysema, coronary heart disease, gastric ulcer, etc. Tobacco chewing is associated with increased risk of oral cancer. Smoking increases carbon monoxide content in the blood and reduces the concentration of heme-bound oxygen. This causes oxygen deficiency in the body. Smoking is injurious to health. This statutory warning is mentioned on the packets of cigarettes. When someone buys a packet of cigarette, it cannot be missed out. Yet, smoking is very prevalent in the society, both among young and old. Knowing the dangers of smoking and chewing tobacco and its addictive nature, the youth and old need to avoid these habits. Any addict requires counseling and medical help to get rid of the habit. Adolescence means both a period and a process during which a child becomes mature in terms of his or her attitudes and beliefs for effective participation in society. The period between 12 and 18 years of age may be thought of as adolescent period. In other words, adolescence is a bridge linking childhood and adulthood. Adolescence is accompanied by several biological and behavioral changes. Adolescence is thus a very vulnerable phase of mental and psychological development of an individual. Let's look into adolescence and drug and alcohol abuse. Curiosity, need for adventure and excitement and experimentation constitute common causes which motivate youngsters towards drug and alcohol use. A child's natural curiosity motivates him or her to experiment. This is complicated further by effects that might be perceived as benefits of alcohol or drug use. Thus, the first use of drugs or alcohol may be out of curiosity or experimentation, but later the child starts using these to escape facing problems. Of late, stress from pressures to excel in academics or examinations has played a significant role in persuading the youngsters to try alcohol and drugs. The perception among youth that it's cool or progressive to smoke, use drugs or alcohol is also in a way a major cause for youth to start these habits. Television, movies, newspapers, internet also help to promote this perception. Other factors that have been seen to be associated with drug and alcohol abuse among adolescents are unstable and unsupportive family structures and peer pressure. How do people become addicted and dependent on alcohol and drugs? Because of the perceived benefits, drugs are frequently used repeatedly. The most important thing which one fails to realize is the inherent addictive nature of alcohol and drugs. Addiction is a psychological attachment to certain effects such as euphoria and a temporary feeling of well-being associated with drugs and alcohol. These drive people to take them even when these are not needed or even when their use becomes self-destructive. With repeated use of drugs, the tolerance level of the receptors present in our body increases. Consequently, the receptors respond only to higher doses of drugs or alcohol, leading to greater intake and addiction. However, it should be clearly borne in mind that the use of these drugs, even once, can be a forerunner to addiction. Thus, the addictive potential of drugs and alcohol pull the user to a vicious circle leading to their regular use from which he or she may not be able to get out. In the absence of any guidance and counseling, the person gets addicted and becomes dependent on their use. Dependence is the tendency of the body to manifest a characteristic and unpleasant withdrawal syndrome if regular dose of drugs or alcohol is abruptly discontinued. This is characterized by anxiety, shakiness, nausea, and sweating, which may be relieved when use is resumed again. In some cases, withdrawal symptoms can be severe and even life-threatening, and the person may need medical supervision. Dependence leads the patient to ignore all social norms in order to get sufficient funds to satisfy his or her needs. These result in many social adjustment problems. Let's look into the effects of drug and alcohol abuse. The immediate adverse effects of drugs and alcohol abuse are manifested in the form of reckless behavior, vandalism, and violence. Excessive doses of drugs may lead to coma and death due to respiratory failure, heart failure, or cerebral hemorrhage. A combination of drugs or their intake along with alcohol generally results in overdosing and even death. The most common warning signs of drug and alcohol abuse among youth include drop in academic performance, unexplained absence from school or college, lack of interest in personal hygiene, withdrawal, isolation, depression, fatigue, aggressive and rebellious nature, deteriorating relationships with family and friends, loss of interest in hobbies, change in sleeping and eating habits, fluctuation in weight and appetite, etc. There may be even some far-reaching implications of drug or alcohol abuse. If an abuser is unable to get money to buy drugs or alcohol, he or she may turn to stealing. The adverse effects are not just restricted to the person who is using drugs or alcohol. At times, a drug or alcohol addict becomes the cause of mental and financial distress to his or her entire family and friends. Those who take drugs intravenously are much more likely to acquire serious infections like AIDS and hepatitis B. The viruses which are responsible for these diseases are transferred from one person to another by sharing of infected needles and syringes. Both AIDS and hepatitis B infections are chronic infections and ultimately fatal. AIDS can be transmitted to one's life partner through sexual contact, while hepatitis B is transmitted through infected blood. The use of alcohol during adolescence may also have long-term effects. It could lead to heavy drinking in adulthood. The chronic use of drugs and alcohol damages nervous system and liver. The use of drugs and alcohol during pregnancy is known to adversely affect the fetus. Another misuse of drugs is what certain sportspersons do to enhance their performance. They misuse narcotic analgesics, anabolic steroids, diuretics, and certain hormones in sports to increase muscle strength and bulk and to promote aggressiveness and as a result increase athletic performance. The side effects of the anabolic steroids in females include masculinization, increased aggressiveness, mood swings, depression, abnormal menstrual cycles, increased hair growth on the face and body, enlargement of clitoris, deepening of voice, etc. In males, it includes acne, increased aggressiveness, mood swings, depression, reduction in the size of testicles, decreased sperm production, potential for kidney and liver dysfunction, breast enlargement, premature baldness, enlargement of prostate gland, etc. These effects may be permanent with prolonged use. In the adolescent male or female, severe facial and body acne and premature closure of growth centers of the long bones may result in stunted growth. Prevention is better than cure. This proverb is true here also. It is also true that habits such as smoking, taking drugs or alcohol are more likely to be taken at a young age, more during adolescence. Hence, it is best to identify the situations that may push an adolescent towards the use of drugs or alcohol and to take remedial measures well in advance. In this regard, parents and teachers have a special responsibility. Parenting that combines with high levels of nurturance and consistent discipline have been associated with lowered risk of substance abuse. Let's look into some of the measures which would be particularly useful for the prevention and control of drug and alcohol abuse among adolescents. Avoid undue peer pressure. Every child has his or her own choice and personality, which should be respected and nurtured. A child should not be pushed unduly to perform beyond his or her threshold limits, be it studies, sports, or other activities. Education and counseling. Educating and counseling him or her to face problems and stresses and to accept disappointments and failures as a part of life. It would also be worthwhile to channelize the child's energy to healthy pursuits like sports, reading, music, yoga, and other extracurricular activities. Seeking help from parents and peers. Help from parents and peers should be sought immediately so that they can guide appropriately. Help may even be sought from close and trusted friends. Besides getting proper advice to sort out their problems, this would help the young to vent their feelings of anxiety and guilt. Alert parents and teachers the need to look for and identify the danger signs discussed above. Even friends, if they find someone using drugs or alcohol, should not hesitate to bring this to the notice of parents or teachers in the best interest of the person concerned. Appropriate measures would then be required to diagnose the problem and underlying causes. This would help in initiating proper remedial steps or treatment. Seeking professional and medical help. A lot of help is available in the form of highly qualified psychologists, psychiatrists, and de-addiction and rehabilitation programs to help individuals who have unfortunately got into the alcohol and drug abuse. With such help, the affected individuals with sufficient efforts and willpower can get rid of the problem completely and lead a perfectly normal and healthy life. The International Day Against Drug Abuse and Illicit Trafficking is a United Nations International Day against drug abuse and the illegal drug trade. It is observed annually on 26th June since 1989. My dear students, you have to be alert and keep away from drugs and alcohol. Be safe and be healthy in all the ways. With this, we come to the end of the chapter, Human Health and Diseases. Thank you.